So I'd say the main difference between child CPR and adult CPR, for one, is the emotional attachment that seems to come with performing CPR in a child. On top of that, most child or infant CPR instances are related to either major trauma or some type of respiratory distress. For children and infants, rescue breaths are critical when it comes to CPR. We need to get oxygen into the blood before it gets circulated and get the compressions going with oxygenated blood.
A child is between age 1 and puberty. If the child looks older than 1 year and has no signs of puberty, consider him a child.
Jonathan, are you okay?
The CAB sequence in CPR is the same for adults, children, and infants, but some of the techniques are a little different. If you're alone with a child and don't have a cell phone, perform CPR for 2 minutes before leaving to call 911. Use either 1 or 2 hands for chest compressions. Compress the chest about 2 inches. Let's review child CPR. Check for response. If no response, yell for help and have them call 911 and get an AED. Check for breathing for 5 to 10 seconds. If there's no breathing or only gasping, begin compressions immediately. Give 30 compressions followed by 2 breaths. Perform CPR for about 2 minutes or 5 cycles. If the child is still unresponsive after 2 minutes of CPR and no one has called 911, call 911 and get the AED yourself. Now let's practice the steps for child CPR on a mannequin.